Good evening and thank you for joining us on this Friday. I'm Brooke Lennington. Coronavirus numbers are back on the rise, and local health officials believe that testing is a critical component in getting this pandemic under control. KSNT News reporter Kelly Peltier joins us now to break down what testing options we have here locally and who they're testing and why. Kelly?
Brooke, here at St. Francis, officials tell me that they have more testing than they did at the start of the pandemic, but still not enough for the amount of testing that they would like to do. Their chief medical officer tells me that to really understand how much coronavirus is in a community, everyone should be tested every day. At St. Francis, they're using a few different methods to test people for the virus. First is the molecular PCR test. This is done with a swab up the nose or by collecting saliva. She says these are the most accurate. The next is the antigen test, also known as a rapid test with results as fast as 30 minutes. This is the test they're using most frequently at St. Francis, simply because they have the most of them. She says the antigen tests are the most accurate when given to people over a number of days. That's because they can sometimes produce a false negative or positive, but says it's important to remember that no test will ever be 100% accurate.
You have to take the clinical picture, so talking to the patient, getting kind of their history of exposure, their symptoms, and then also how much the virus is present in the community will tell you really how accurate your test is.
Finally, there's the antibody test, which is a blood test. It only tells if you previously had the virus, so it's not a good test to see if you're actively infectious. She says the antibody test has been the most helpful when they were giving convalescent plasma to patients for treatment. As for who they give these tests to, she says the guidelines have become a lot less restrictive since the start of the pandemic.
If you have a fever, a cough, shortness of breath, fatigue, headache, the loss of taste and smell, so if there's a high suspicion of exposure, then it's pretty easy to say, yes, we should test. And there's a lot of times where if the individual just wants it now, we can just test, particularly in the outpatient arena.
All staff are required to do a self-screening before they go into work. That includes taking their temperature and also getting tested in certain situations. She says until we have an effective vaccine, everyone in the community needs to continue those safety guidelines that we've heard about since the beginning of this pandemic. That means social distancing, washing your hands, and continuing to wear a mask. Reporting live in Central Topeka, Kelly Peltier, KSNT News.